If you're a man over 60, you may have quietly wondered about a subject that rarely makes its way into open conversation. How does masturbation really affect your health and your penis at this stage of life? You're far from alone in thinking about it. Despite being one of the most common human behaviors, it's still wrapped in old myths, cultural taboos, and an odd shortage of straightforward, trustworthy information. That silence often leaves room for confusion, half-truths, or unnecessary worry about something that is, in reality, a completely natural part of life. For many men, the question boils down to whether this habit is helping or harming them. In this discussion, we're going to cut through the noise and have a clear fact-based talk about it without the embarrassment or outdated ideas. We'll look at the benefits that science has uncovered, but we'll also cover the possible downsides so you can make informed choices for your health. And because we might as well start with the uplifting side, let's begin with what masturbation can do for you in later life. One of the most important physical benefits is the way it helps maintain penile health. An erection is more than just a sexual response, it's a workout for your penis. When you're aroused, blood fills the spongy chambers called the corpora cavernosa, carrying oxygen-rich blood that keeps the tissue nourished, elastic, and functioning well. Think of it like keeping a muscle flexible through regular stretching. The more consistent the blood flow, the better the tissue retains its ability to expand fully and reliably. Over time, this kind of natural exercise supports stronger, more dependable erections, whether they come from partnered intimacy or solo activity. Closely linked to this is prostate health. Large-scale research, including a well-known Harvard study, has found that men who ejaculate more frequently have a reduced risk of developing prostate cancer. Scientists believe this is because ejaculation clears the prostate of old cells and fluids, which could otherwise allow potentially harmful substances to build up. Simply put, this act can act as a gentle maintenance routine for one of your body's most important glands. Another advantage that's often overlooked is the strengthening of your pelvic floor muscles. These muscles, which support the bladder and bowels, also play a major role in sexual function by helping to maintain erections and producing the rhythmic contractions during orgasm. Every climax is like a mini workout for them, and keeping them strong has ripple effects on bladder control, erection quality, and orgasm intensity. Of course, not all benefits are purely physical. Some have just as much to do with your mind. Orgasms trigger a measurable drop in cortisol, the stress hormone that can damage your health when levels stay high for too long. That post-climax calm is more than just a pleasant feeling. It's a genuine physiological reset that supports heart health, immune strength, and overall peace of mind. Alongside stress relief, masturbation also gives your brain a chemical lift. It prompts the release of dopamine, which fuels motivation and pleasure, and oxytocin, the hormone tied to bonding and contentment. This neurochemical cocktail can leave you happier, more relaxed, and better able to handle life's emotional ups and downs. Another subtle but valuable advantage is self-awareness. Regular self-pleasure keeps you familiar with the normal look and feel of your penis and testicles, which makes you more likely to notice any changes, such as lumps, hardness, or curvature, at an early, more treatable stage. And if falling asleep has been more of a challenge lately, the combination of hormones released after orgasm, particularly prolactin and oxytocin, can act as a natural sedative, helping you drift off faster and enjoy deeper, more restorative rest. There are also benefits that affect sexual performance and desire more directly. For men concerned about finishing too soon during intimacy, masturbation offers a safe environment to learn more about your body's rhythms and develop greater control. Practicing techniques like pausing before the point of no return can help extend stamina during partnered sex. Just as important, regular sexual activity, solo or otherwise, keeps the brain's sexual pathways active. Desire begins in the mind, and keeping those neural circuits engaged can help maintain a healthy libido well into later years. There's truth to the old saying, use it or lose it, when it comes to sexual interest. Finally, when you step back and look at the full range of advantages, from improved blood flow and muscle tone to better mood, sleep, and self-knowledge, it's clear that masturbation isn't just a recreational activity. It's part of maintaining your overall health and vitality, as relevant as eating well, exercising, and getting enough rest. But to truly make it a healthy part of your lifestyle, it's equally important to understand the potential risks and limitations. Ignoring them can undo some of the most common issue is simple skin irritation. The penis is sensitive, and repeated friction without lubrication can cause soreness or redness. A high-quality, body-safe lubricant can prevent this, making the experience smoother and more comfortable. Related to this is what some call death grip syndrome, which happens when a man becomes accustomed to using a very tight, intense grip that a partner can't replicate. This can lead to difficulty reaching orgasm during partnered sex, but it's avoidable by varying your technique and occasionally using a gentler touch. There's also the small but real risk of injury. Being too rough, especially bending an erect penis, can result in bruising or, in rare cases, a penile fracture, which is a serious emergency requiring immediate medical attention. Listening to your body and avoiding forceful or awkward angles is key. For a few men, the problem isn't physical at all, but behavioral. Masturbation can in some cases become a compulsive habit that interferes with work, relationships, or daily life. If it starts feeling like your only way to cope with stress or loneliness, it may be worth talking to a professional for guidance. A different kind of risk comes from pornography. While it can be a helpful aid for arousal, consuming it heavily can lead to unrealistic expectations about what real sex looks like or how partners should behave. It can make ordinary experiences seem less exciting by comparison. Staying mindful of the difference between fantasy and reality helps prevent that disconnect. Emotional health can also be affected by lingering guilt or shame, especially for men who grew up in more conservative times. Those old messages can still carry weight decades later, creating unnecessary stress around a normal, healthy act. Recognizing masturbation as a positive and consensual part of sexual health can help release that burden. If you have conditions like prostatitis, severe Peyronie's disease, or any painful inflammation in the genital area, masturbation could aggravate symptoms. In such cases, following a healthcare provider's advice is the safest. And while masturbation is a healthy outlet, it's not a replacement for intimacy if that's something you value. Emotional closeness, shared pleasure, and communication with a partner are distinct experiences that solo activity can't fully replicate. Good hygiene is another simple but important point. Washing your hands and genital area before and after helps prevent infections like urinary tract issues or balanitis. Finally, even though self-examination during masturbation is a great early warning system, it's no substitute for regular medical checkups. Routine visits to your doctor, including discussions about prostate health and screenings, remain essential as you age. So what's the bottom line for men over 60? The evidence is clear that masturbation can be a valuable ally in maintaining not just sexual health, but overall well-being. It keeps the tissues of the penis in good shape, supports prostate function, strengthens key muscles, boosts mood, lowers stress, and even helps you sleep better. It can sharpen your sexual self-awareness, maintain your libido, and serve as a tool for performance improvement. But it's not a magic cure-all, and the benefits are best realized when you approach it with balance, staying mindful of potential pitfalls like excessive grip, unrealistic expectations, or over-reliance as an emotional crutch. Think of it as one piece of a broader lifestyle that also includes proper diet, regular exercise, meaningful relationships, and consistent medical care. With that balanced approach, you can enjoy the physical and emotional rewards of sexual activity well into your later years without sacrificing health or comfort. Talking openly about these things is part of taking ownership of your well-being, and there's nothing shameful about that. In fact, understanding and embracing this aspect of your health may be one of the more unexpectedly empowering steps you can take as you continue the journey of aging well.